In this presentation, we're going to be talking about the stages of the evaluation process, all the way from a referral to the child's placement and evaluation. So let's get started. Alright, so here we're going to discuss the evaluation process. So a quick overview of it is it starts with the referral, then you have the evaluation, then the development of the IEP or the individual education program, then the child is placed, given instruction, and then the annual review. So starting off with referral. This is when the referral of a child for diagnosis may be formal or informal, and it may come from a parent or from others. So it might come from the homeroom teacher or a daycare worker or someone who identifies there may be some kind of disability here. Then the child is assessment and diagnosed. So multidisciplinary, non-biased, comprehensive battery of tests is given. And then this complete reevaluation for classification is required every 3 years. So they are reassessed every 3 years. Okay, then classification comes about, and this includes you guys, your parents. So you are included on this. So teams review the plan or review the diagnostic data and classify for special education based on the test results. So they'll look at the child's test scores and determine if that does qualify them. And parent signature is required, so you guys have to approve this. If you do approve it, the IEP meeting is held. This is the individualized education program, and again, you guys need to be here. So this is updated yearly, but the team or parent may request as needed. So if you feel things need to be changed, you can request that earlier and vice versa. Okay, and again, your signature here is required. Placement again is your call. So team decides placement based on the IEP, and parent signature is required here. So based on the goals and all of this, you need to agree to it. Then the child is placed. Okay, so this again, the team decides the placement based upon that IEP. Alright, last but not least, the evaluation team meeting. The team evaluates your child's total special education program and their progress at least yearly, and you are here. Okay, so teacher evaluates their daily work and brings results from their short-term objectives and determine the kind of progress your child's making, and you are here to see this. There is some parental rights that we kind of discussed on previous videos, but this is for the initial evaluation. So you as a parent might feel that something is wrong with your child, or someone may have approached you and said, hey, and had some concerns. You know, I think so-and-so has learning issues. Okay, so you can get them tested. But for initial evaluations, notice must be provided to evaluate the child, okay, and the parental consent needs to be obtained. No single procedure shall be the sole criterion for determining eligibility, so we need multiple tests here. The child must be assessed in all the areas of suspected disability. Determination of eligibility shall be made by a team of qualified professionals and the child's parents. Okay? Children are not eligible if only one deciding factor is limited to English proficiency or a lack of math or reading instruction. Okay, so you can't refer someone for having a disability if, for example, they have poor English skills, they don't speak well, they can't read that well due to a different language. And again, your consent is pretty much on all of these. You need to allow evaluation and testing to occur. You need to approve the IEP, the goals on that IEP, and their placement, and you need to be evaluated and updated on the amount of instruction they're getting. And you can determine how frequently you want that child's goals to be reviewed.